So today we are going to talk about ULCER. ULCER, break in the continuity of the covering epithelium. This covering epithelium might be skin or mucous membrane, and it is due to molecular death. Okay. Once again, the definition of ulcer is break in the continuity of the covering epithelium due to molecular death. Now we see the parts of ulcer. Ulcer has floor, base, edges, and a margin. Now here these are different types of ulcer: sloping, punched out, beaded, undermined, and raised and beaded. Now classification of ulcer, this is important. Based upon the duration, it is of two types: acute and chronic. If the ulcer is less than 2 weeks, then it is called as acute ulcer, whereas if the ulcer is more than 2 weeks, then it is called as chronic ulcer. Now clinical classification. Okay, so in clinical classification, they are mainly divided into 4 types. The first one is spreading ulcer. Here the edges are irregular and the floor has a lot of purulent discharge, whereas in a stationary ulcer, it is chronic and it is non-healing, and the floor has pale granulation tissue. Now third one is healing ulcer. Healing ulcer has pink or red granulation tissue. Pink or red granulation tissue means a healthy granulation tissue, means the ulcer is healing, and there is decreased serous discharge on the floor. Now if we see non-healing ulcer, there is unhealthy granulation tissue in the floor, and non-healing tissue, based upon the edges, it can be again further subdivided. It might be punched out. This is punched out. Example trophic, undermined. Example tubercular, and this is beaded ulcer. Example is rodent ulcer. Now the pathological classification. Pathological classification is again of 3 types: specific, non-specific, and malignant. Specific ulcer, examples are STAM. This is a small mnemonic, you can say, to remember. That is how I remember. It is STAM, STAM. S stands for ulcer due to syphilis, trophic ulcer, actinomycosis ulcer, and Mylanese ulcer. Now non-specific ulcer, it may be arterial ulcer, venous ulcer, trophic ulcer, tropic ulcer, traumatic ulcers, or diabetic ulcer.